Good afternoon, and thank you for joining us on this exciting occasion. I'm Stanley Brown, Dean of the Dalla Lana School of Public Health, and I want to start with a land acknowledgement. We at the Dalla Lana School of Public Health wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. And the work that we'll talk about today, and the way it's being shaped, demonstrates that the Dalla Lana School is committed to taking real action and keeping our word on making progress towards righting our relations with Indigenous peoples. Now, we have an exciting piece of news to announce today. And although I'd love to be the one to share it, especially because it involves one of our own students, that honor belongs to our university president. So with that, I'd like to hand the microphone to Professor Merritt Gertler, President of the University of Toronto.
Thank you, Dean Brown. Good afternoon, everyone. Thank you for joining us to celebrate a bold move to strengthen the health of parents and children for many years to come, and to express our deepest gratitude to the Vohra-Miller Foundation for making this very hopeful development possible. As all parents know, the experience of expecting and welcoming a baby brings many joys. It also brings many challenges, and not just in the form of sleep deprivation. New parents must navigate the potential risks to their children, including those posed by everyday substances such as medications, household chemicals, and pollutants in our air and water. And many parents face even greater difficulties in promoting the health of their newborns. For example, if they face health challenges of their own, if they must contend with poverty, income instability, or housing issues, or if they live in remote or underserved communities. Empowering these families so that they and their children can flourish is crucial. But there's a void in the research and the public-facing information that are needed to do so. Today, the Vohra-Miller Foundation is stepping forward to fill that void. And I'm delighted to announce that through a visionary gift of $5 million to the University of Toronto, they are enabling us to launch a truly vital new initiative. This initiative, to be known as First Exposure, will draw from our world-leading expertise in maternal and child health to meet the needs of people across Canada, especially those in marginalized, vulnerable, and underserved populations. Hosted at the Dalla Lana School of Public Health, First Exposure will provide an information hub and research network to address crucial gaps in healthcare for these families. We'll hear more about the transformative impact of First Exposure in a few minutes. But for now, on behalf of the University of Toronto, I want to say to Sabina Vora-Miller, Craig Miller, and the Vohra-Miller Foundation, thank you for your vision, your leadership, and your generosity. Thank you for the hopeful future you're making possible for countless families and children. And thank you for enabling us to make that future, your vision, a reality. Now, back to you, Dean Brown.
Thank you, President Gertler, for your words. And now I'd like to introduce that Dalla Lana student. She's someone who I believe needs no introduction. She's played a remarkably prominent and critical role during the last 2 years, helping to communicate COVID science to the public. Sabina Vora-Miller has been a treasured member of the Dalla Lana community for several years now. With her scientific background, her deep commitment to equity in public health, and her remarkably masterful ability as a communicator, she has helped to shape some of our most impactful and innovative initiatives. Sabina and her husband, Craig Miller, represent a new generation of philanthropists who understand the vital importance of technology and communication. They've done much to show us how these elements can be used effectively in creating public health that helps to close the equity divide. They understand that if we don't put equity front and center, the best laid plans can inadvertently reinforce inequities. That vision is very evident in all of the initiatives they support at our school, from the Institute for Pandemics to First Exposure. But before I introduce Sabina, I want to take a bit of credit. I want to say that we must be doing something right at the Dalla Lana School because she's now part of the first cohort in our Doctor of Public Health program. These are students we are educating to take on greater and greater leadership roles in our health system. And the idea that one day Sabina might be our health minister or some other sort of unfortunate position like that, Well, that's actually a very, very happy idea. And with that, I'm delighted to introduce Sabina Vora-Miller of the Vora-Miller Foundation.
Good afternoon, and thank you all for joining us today. By way of background, the Vohra-Miller Foundation was launched in 2020 with the purpose of improving the health of the planet and its people. Our goal is to make people thrive by building resilient and healthier communities while ensuring no one is left behind. As someone with a background in clinical pharmacology and being a parent to a young one myself, providing families with evidence-based information that is readily available is exceptionally important to me. First Exposure does exactly that by committing to provide information on exposures to medications, vaccines, environmental chemicals, and substances in pregnancy and lactation in a timely and dignified way to not just healthcare professionals, but every single parent. This will be undertaken through a very intentional approach to embed equity and inclusivity into every aspect of this work, all while being grounded in science and knowledge from a wide range of experts and through lived experiences. First Exposure has been 3 years in the making, and I am grateful to all our collaborators and partners, especially the Dalla Lana School of Public Health, to bring our vision to reality. I am thrilled to introduce this new initiative to you today. Thank you.
Thanks so much for this, Sabina, and thanks for your many ways that you've committed to the Dalla Lana School. We're truly lucky to have you as part of our community. To be more specific now, I'm going to ask First Exposure's medical lead on our toxicology review team to give us more details on the program. Please welcome Dr. Cindy Maxwell, who leads the Division of Maternal Fetal Medicine at Sinai Health here in Toronto.
Thank you, Dean Brown. I am pleased to be sharing with all of you more specifics. First Exposure is a collaborative, interprofessional educational network focused on the emerging science of how substances can affect pregnancy, lactation, and human development. We'll begin by focusing on pharmaceutical medications, but will grow to including vaccines, environmental chemicals, and home remedies, all informed by determinants of health. Most of us have substances in our systems that can cause effects without us being aware. Understanding the effects these substances can have on our well-being is an expertise we're building at the University of Toronto to fill an international void. First Exposure will have rigorous scientific leadership, including the input of Dalla Lana population health leads and a community of partners to determine program priorities and advice. A strong privacy framework and representative governance structure will ensure published information is science-based and tailored for diverse populations accessing the service. As an obstetrician and maternal fetal medicine specialist, I will rely on this information to give the best care to the patients that I care for with complex conditions who may be on multiple medications as part of their pregnancy care. We look forward to having First Exposure as a platform on which patients with high-risk conditions and their healthcare team can depend. The program will offer a database, a mobile website, and resource hub to provide the public and clinicians with information where and when they need it. Community representatives and organizations will be involved in co-designing resources tailored to the needs of Indigenous, Black, Asian, LGBT, 2SQ, newcomer, and differently abled populations.
Thank you, Cindy, for the time you and the review team are putting into ensuring First Exposure's advice considers the highest quality and most appropriate evidence. To look further at the scope of work, I am pleased to introduce Dr. Jennifer Blake, who's recently joined us at the Dalla Lana School. Many of you know Jennifer. Her career spans clinical, research, and leadership roles across the Canadian healthcare system. She's an obstetrician and gynecologist, scientific director of First Exposure, and a professor here at the Dalla Lana School of Public Health.
Thank you, Dean Brown. I'm so pleased to be here with you today for the launch of First Exposure. And as Cindy has outlined, we have a pretty ambitious vision for where we're going. We are, as she explained, beginning with those medications that may be needed during pregnancy and lactation. We will maintain an up-to-date, research-grounded database of drug toxicology and safety information on up to 500 of these medications with detailed information for all users. Ethics and privacy processes will ensure that all information is kept safely protected. The website will include tools to help users with everything they may need, from pronunciation to the international names, the cost, appropriate use, right through to specific considerations and possible alternatives to each medication. The First Exposure team cares deeply about the impact medications can have and will endeavor to ensure safety and reduce harm for all people. The program will serve individuals, families, and healthcare professionals, including obstetricians, family doctors, pediatricians, midwives, nurses, and pharmacists. First Exposure has already begun to partner with Canadian scientists, knowledge users, and databases to expand what we know about the effects of medication in pregnancy and lactation. In partnership, we will support population health literacy, healthcare pathways, system supports, and healthcare integration for all. We look forward to seeing First Exposures grow to become a center for innovative, inclusive pregnancy, lactation, and parenting information, as well as for research and education here at the Dalla Lana School of Public Health at the University of Toronto. On behalf of the team, we want to thank Dean Brown for his leadership, and we want to thank the Vora-Miller Foundation for this tremendous gift. Sabina, thank you.
Thank you, Jenny. We're excited for where the partnerships for First Exposure will lead us and for the impact that we know it's going to have. The need in so many countries, not only across Canada, but in so many countries around the world for this information is significant. And work like this can't happen in a silo, and it doesn't start all on its own. I want to take a moment to acknowledge the foundational work and the ongoing contributions of Dr. Shinya Ito and Anna Pupko from Sick Kids Hospital and the Dalla Lana First Exposure team. Also like to thank Annette Paul, former Director of Advancement, who was the anchor at the origin of this project. I want to thank Wendy Catherine, Executive Director of First Exposure, and the team at Health Nexus, Katerina Frlova, Marine Delage de Luget, and Halima Siddiqui, and our health leads from the Dalla Lana School, Roberta Timothy, Angela Mashwood-Pringle, Ryan Hines, and Daniel Grace. We're grateful to the many scientists, clinicians, and community representatives who are working with First Exposure to build and sustain the program's strong scientific foundations and breadth of lived experience, to build off of those for something that will have truly global impact. And now, I'd like to introduce our final distinguished speaker, Rose Patton, University of Toronto Chancellor. Dr. Patton is a longtime leader in the financial sector and a mentor to women and early career professionals at U of T and elsewhere. She's the former chair of the university's governing council, an officer of the Order of Canada, and the recipient of the Queen Elizabeth II Diamond Jubilee Medal. It is my honor to pass the podium to Dr. Patton.
Thank you, Dean Brown, and good afternoon to everyone. I'm so very pleased to join in this wonderful announcement today. First Exposure will be truly transformational as it grows over the years and begins to close the critical gap in maternal and child health. And it's such an inspiring initiative to help vulnerable people across Canada in achieving a greater lifelong health. The Vora-Miller Foundation gift is indeed visionary. It's a visionary investment in every way. Your groundbreaking leadership will enable the creation of a crucial hub of information. You're also helping to train the next generation of leading researchers and clinicians, while supporting innovative projects and partnerships in this field. Ultimately, you're enabling us to serve marginalized and underserved populations more effectively, helping to lift and strengthen so many individuals, families, and communities. It will be so exciting to see what First Exposure will make possible, not just through what today's investigations will discover, but also what the talent of tomorrow might find. And so as Chancellor, let me say once again, On behalf of the entire University of Toronto, thank you. Thank you to Sabina Vora-Miller, Craig Miller, and the Vohra-Miller Foundation for your exemplary leadership. And to everyone who has joined us today, thank you so much for being part of this important announcement. Thank you all for your continued engagement with the University of Toronto.